Okay, so I haven't been recording at all because I haven't, like, we never really feel like to talk. Yesterday was the first day for me and Rob, and we're just trying to orient ourselves. We weren't really sure what to do or where to go or everything, but we're figuring it out as we go along. So as we become more confident, then I'll have more to speak about. So I don't want to like force it now, and then I don't really have any valuable information to share or to give. So I didn't really record last week because it was the first week and I wasn't really sure of anything. We just did want the week pass first, and then when I feel more confident, I share. The first week was really busy, learning a lot more on this rotation, and I actually like I like medicine, so I prefer it over the other rotations I've done so far. We get way more freedom on the ward to do things, like we can actually help out more. And we actually get homework, and on a consultant ward rounds, they ask us a lot of things. And honestly, you never know half of something when she asks me. I'm there looking at Rav like, Rav, you can communicate with people without words. So I'm looking at her like, then I look at the resident, I'm like, help me, help. In my eyes, they can't see. And usually looking at me like, we got homework. So we're supposed to read up on paraneoplastic syndrome, Light's criteria, and SAAG gradient. So it's a lot of information, but it's interesting, like it makes sense. Triple gauge, triple lumen. So into the diameter. So what are we doing, Rav?
We are on our venture tour overnight for internal medicine. So come along with us. We're not going to start.
And also we did the exam today, but we went overtime, so she said we must come back tomorrow and do it. So I'm going to practice for that when my cousins get home, so I can practice on them. And after this, I'm going to ask you to take some deep breaths from here, right? Starting now. Palpating for the spleen. Could you turn on the side for me, please? Okay. If the kidneys are too big, that's a problem. It's week 3, and yesterday I did my first OSCE. It wasn't bad. I could have done better. I practiced a lot, and then yet still I ended up messing up because I was really nervous. But when you practice for something over and over again, and then you feel like you're ready for it, and then due to nerves or something you kind of mess up. So I was disappointed, and I ended up crying in front of the consultant. And I felt so bad because I could tell that she felt bad because she was proud of Rav and I just wasn't really proud of myself at the time. That's how it went. We were to do an abdominal exam, and I forgot to do the hands and to do like some other things. But anyway, I have a next one on Friday, so I'm hoping that one will go more smoothly. So today was nice. We had class with our consultant. He's really nice. And for today's class, we were talking about lupus, and we got a case, and he asked us questions throughout, like what are the differential diagnoses, or what are some signs, or how do you manage this patient, or what other, like he's very interactive, and I like that with his classes, but I kind of zone out a bit today, to be honest. But after that, my friend, or our friend Kimali, he helped us because we have respiratory exam to do. We have that to do on Friday, so he was going through that with us. He's so smart. So we're trying to learn from him and then correct the patient, because what our other consultant does is whenever she has clinic, she asks us to write a full history on a patient a day before, and then we'd go to clinic the next day and present it to her, and she would correct us, or she would give us, not really correct, but she would add on and give us more questions that we could possibly ask that patient, so we get better each time. I want to get some books, like just writing books, start writing and making notes. I want to start doing a topic a day. And now I'm just gonna run through some of my favorite moments with Rav on this rotation. We went to the Uptal clinic, so we're learning about diabetic retinopathy. Retinopathy. And then it was so cool because we actually got like one-on-one teaching and how to operate the machines, and this was from class with Dr. Rose, and we would always try to go over exams and make sure that we get them for Monday and Friday when she examines us. Yeah, and then we'd have classes with our doctor or consultant. Those are always very interesting, the cases that he would find. And yeah, when we're just talking to each other, we talk a lot, but it's always fun. Alright, so what's the weirdest thing that you've ever seen on a ward, like on a rotation so far? Or something that scared you?
Weirdest thing I've ever seen. There was a gentleman that seemed to have some like decreased respirations, like he seemed like he was passing, but he wasn't fully passed. At one point I thought he had passed. So my feeling pulse is that as I touch the man go,
yes. Yes, remember. Minute did it right? 2 minutes.
I almost ran away. You know why I speak spoken for them? It's because of the video. What's the scariest thing you've ever witnessed, or something that's probably gonna stick with you throughout this whole experience, or has made you look at things differently since experiencing that?
When I saw, was it ovarian cancer?
Mm-hmm.
And I saw like all the different like fluids coming out of the body, not necessarily blood, but it was scary, and I've never seen that before. And yeah, that's gonna stick with me for life.
Have our appreciation. We had really a lot of fun working with you guys. I really appreciate everything that you do. You guys are so good at your job. Hopefully one day.
So yeah, I'm not really sure what I shared in the first parts of the video, but internal medicine was my absolute favorite rotation. I learned so much. Dr. Rose, Dr. Gregory, Dr. Yukala, they are excellent teachers, and Rav and I were so grateful. I really wanted Rav to just be a part of this video as well, but our timing just never really sync up, so we never really get around to doing a video with both of us together. But it was so good. The topic list for internal med is quite long, but I tried my best to do as much topics as possible. So I think I only had just a few left. So I'm really proud of myself. If you want, I can share with you the topics that are important on the each rotation. You can just DM me at Esiame, ECIIAME, and I'll let you get the link, or I'll just send you the document. And yeah, So now I'm on surgery and I really haven't been recording my surgery journey as it, because I'm just recently getting into the groove of understanding what is going on. And so hopefully this week I can start sharing more and making these videos. It's surprising to me how this video isn't longer, because internal med was 3 months and I did so much, we learned so much, and I still don't understand why the video is short, but you know, it is what it is. And so excited for this journey. 3 rotations down so far. So you know how I never like peds, we're gonna do peds next, and so I am just trying to prepare myself. Like, I'm trying to tell myself every day, I love peds, I love peds, I'm gonna learn a lot, I'm going to enjoy it, I'm going to learn a lot, I'm gonna enjoy it. And hopefully when I start, then I'll just be in a better frame of mind, because last year was just not it for me. I was just not there mentally, and you can, if you haven't watched that video, I'll explain more in that video on this channel. So yeah.